There's a question I've heard whispered in my clinic for over 20 years now. Men lean in close during checkups, lower their voices, and ask with a mix of embarrassment and genuine concern. At 73, one of my patients from Calgary finally built up the courage to ask me last month. And you know what? His question changed how I approached this conversation entirely. He said, "Dr. Brooks, I thought something was wrong with me until I read this Harvard study, but I still don't know if what I'm doing is healthy at my age." That conversation is why I'm here today, because if you're over 60 and wondering whether masturbation is healthy for older men, you're not alone. And the science behind the answer is absolutely going to surprise you. I'm Dr. Natalie Brooks, and I've spent more than 2 decades working in urology here in Canada, helping men navigate their health concerns with honesty and dignity. What I'm about to share with you today isn't just medical theory. It's backed by solid research from institutions like Harvard Medical School, the American Heart Association, and peer-reviewed journals. But more importantly, it's information that could genuinely improve your quality of life, no matter where you're watching from, whether that's Toronto, Vancouver, Winnipeg, or anywhere else. Let's be honest about something right off the bat. We live in a culture that's wrapped this topic in shame, outdated beliefs, and cultural taboos. You've probably heard all the myths that sexual activity becomes inappropriate after a certain age, that it's somehow harmful to aging bodies, that it's just something men should outgrow. Some folks even believe it might worsen age-related prostate problems or heart issues. But here's the thing, and I need you to really hear this. What if everything you've been told about sexuality and aging is completely backwards? What if the science reveals something so surprising that it fundamentally changes how we think about healthy aging for men? Today, I'm going to share with you what decades of urological research actually show. And I promise you, the truth isn't just eye-opening, it's liberating. Stick with me because this information could literally change your life, and by the end of this video, you'll have practical steps you can take right now. Let me start with some uncomfortable truths about the reality of aging and male sexuality, because we can't address this properly without understanding what's actually happening in your body. As men age, your bodies change. That's just biology. Testosterone levels decline gradually, typically around 1% per year after 30. This isn't just some trivial detail, eh? Lower testosterone affects muscle mass, bone density, energy levels, and yes, sexual function. Many men experience what we call age-related erectile changes. Now, this doesn't mean complete dysfunction. It means things work differently. Erections might take longer to achieve, they might not be quite as firm, and the recovery time between sexual activities increases. This is completely normal, folks. But here's where it gets interesting, and I really want you to pay attention to this. Despite these changes, research shows that sexual desire and the capacity for sexual pleasure don't simply vanish with age. In fact, many men maintain healthy sex lives well into their 80s and beyond. The key is understanding what healthy looks like at different life stages. Now let me address some of the specific myths and fears that stop older men from embracing healthy sexuality, because I hear these in my office every single week. Myth number 1, I'm too old for this. The truth? There's no expiration date on sexual health. Men in their 70s, 80s, and older can maintain healthy sex lives. I've got patients in their late 80s who are more sexually active than some 40-year-olds, and you know what? They're thriving. Myth number 2, it's not normal at my age. The truth? Studies show that 40% of men over 65 masturbate regularly. You're not alone, and you're definitely not abnormal. In fact, you're part of a huge group of men who are taking their health seriously. Myth number 3, it'll make my medical conditions worse. The truth? For most men, sexual activity is safe and beneficial, even with common age-related conditions like diabetes or heart disease. Always consult your doctor, obviously, but don't assume the worst. I've seen far more harm come from men avoiding healthy sexual activity than from engaging in it responsibly. Myth number 4, I should save my energy for other things. The truth. Sexual activity actually gives you energy by improving circulation, reducing stress, and promoting better sleep. Think of it like exercise for your cardiovascular system, because that's essentially what it is. Let's be honest about the practical reality of what changes with age, because I think this is where a lot of confusion happens. You might need more time for arousal, You might not have the same frequency of desire you had at 25. Recovery time between sexual activities increases. These are normal changes, not failures. The key is adjusting expectations and finding what works for your body now, not comparing yourself to who you were decades ago. Some men discover that masturbation becomes more about stress relief and overall wellness than intense physical pleasure. Others find that with less pressure to perform, they actually enjoy sexual experiences more. There's no right or wrong here, just what feels healthy and good for you. Now, before I go further, I want to hear from you. If you're watching from Canada or anywhere else, drop a comment with your city so I can give you a shout out in my next video. I love knowing we've got a community from coast to coast supporting each other on these important health topics. Whether you're in Halifax, Saskatoon, or Victoria, let me know you're here. All right, let's talk about the brain benefits, because this is about so much more than just the physical side of things. Sexual activity, including masturbation, triggers the release of powerful neurochemicals that become increasingly important as we age. During orgasm, your brain releases a cocktail of beneficial chemicals. Endorphins, which are natural painkillers, oxytocin, the bonding hormone, prolactin, which promotes relaxation, and dopamine, the pleasure chemical. For older men, these chemicals can help combat depression, reduce anxiety, improve sleep quality, and even help with pain management. I've had patients tell me their chronic back pain feels more manageable after sexual activity, and there's actual science backing that up. There's also emerging research suggesting that regular sexual activity might help protect against cognitive decline. A study published in the Archives of Sexual Behavior found that older adults who maintained active sex lives scored better on cognitive tests and showed better memory function. Now, we can't say it prevents dementia, but the correlation is definitely worth noting. Here's something that might surprise you, and honestly, it surprised me when I first read the research. The immune system boost. Sexual activity actually strengthens your immune system. Research from Wilkes University found that people who had sex once or twice per week had 30% higher levels of immunoglobulin A, an antibody that helps fight infections. For older men whose immune systems naturally weaken with age, this boost can be particularly valuable. It's like getting a natural immune system upgrade without any side effects. Now let's talk about the cardiovascular connection, your heart and your health, because this is probably the biggest myth I need to bust. There's this persistent belief that sexual activity, including masturbation, is dangerous for older men's hearts. This fear comes from occasional news reports about heart attacks during sexual activity. But what does the science actually say? The American Heart Association has been very clear on this, folks. For most men, sexual activity is no more strenuous than climbing 2 flights of stairs or taking a brisk walk. The actual risk of having a heart attack during sexual activity is incredibly small, about 2 to 3 chances in a million for a healthy man. But here's the really shocking part. Regular sexual activity, including masturbation, might actually be good for your cardiovascular health. Studies show that men who have regular orgasms have lower blood pressure, reduced stress hormones, and better overall markers of heart health. A landmark study, published in the American Journal of Cardiology, followed over 1,000 men for 16 years. The results were stunning. Men who had sex less than once per month had a 45% higher risk of cardiovascular disease compared to men who had sex twice per week or more. Now, I want to ask you something important so I can create better content for you. What concerns you more right now? Type 1, if it's maintaining your cardiovascular health, or type 2, if it's your prostate health. This really helps me understand what information you need most urgently, and I read every single comment, I promise you that. Let me tell you about the prostate protection secret, because this is probably the most important part for men your age. Remember that Harvard study I mentioned at the beginning? Well, the benefits don't stop at cancer prevention. Regular ejaculation appears to support overall prostate health throughout a man's life, and this becomes even more crucial as you age. Here's why this matters so much for older men. As we age, the prostate naturally enlarges, a condition called benign prostatic hyperplasia, or BPH. This can cause those frustrating symptoms you might already know about. Frequent urination, weak stream, feeling like you can't completely empty your bladder, and those annoying trips to the washroom at night that interrupt your sleep. Research suggests that regular ejaculation helps maintain healthy prostate function by preventing the buildup of prostatic fluid and promoting better circulation in the area. It's like a natural maintenance system for one of your most important glands. As Dr. Abraham Morgentaler from Harvard Medical School puts it, the prostate is designed to be used. Regular ejaculation is part of its natural function, regardless of age. Now, I've gotten questions from many of you, and I want to address the top 3 that come up most often in my practice and in my comments section. Question 1. I have an enlarged prostate. Is ejaculation still safe for me? This is such a common concern, and I'm glad you asked. For most men with BPH, regular ejaculation is not only safe, it's beneficial. However, if you experience pain during ejaculation or blood in your semen, you need to see your doctor right away. Those are warning signs that something else might be going on. Question 2. I'm on heart medication. Can I still masturbate safely? In most cases, yes, but this is absolutely a conversation to have with your healthcare provider. If you can climb stairs without chest pain or extreme shortness of breath, sexual activity is generally safe. But certain medications, particularly some blood pressure meds and nitrates, can interact with sexual activity, so please talk to your doctor about your specific situation. Question 3, and this is one I've been seeing a lot. My partner can't or doesn't want to have sex anymore due to health issues. Is masturbation a betrayal? This is such an important question, and I'm so glad people are asking it. Let me be crystal clear. Masturbation is not infidelity. It's self-care. It's health maintenance. If your partner can engage in sexual activity due to health reasons, maintaining your own sexual health through masturbation is absolutely appropriate. In fact, I encourage couples to have open, honest conversations about this. Your partner who loves you would want you to take care of your health, and that includes your sexual health. Let me share a story with you. And I've changed details to protect privacy. But this is based on a real patient. Robert, 71, from Mississauga, came to see me because he was experiencing nocturnal emissions, wet dreams once or twice a week. He was mortified, thought something was seriously wrong. After examining him and running tests, I explained that this is actually completely normal. His body was simply doing what it's designed to do, clearing out built-up prostatic fluid. We talked about how regular masturbation might reduce these episodes if they bothered him, but that there was nothing medically wrong. The relief on his face was incredible. Sometimes the biggest health intervention is just providing reassurance and accurate information. Now, let me give you some practical guidelines because I know that's what you're really here for. How often is healthy? Here's the thing, there's no magic number, but research from Harvard suggests that ejaculating 21 times per month or more was associated with reduced prostate cancer risk. That breaks down to about 5 times per week. But listen, this isn't a prescription, it's just data. Some men might find twice a week feels right. Others might prefer more or less. The key is listening to your body. What about safety considerations? If you have a history of heart problems, start slow and pay attention to how your body responds. If you experience chest pain, severe shortness of breath, or dizziness, stop and contact your doctor. Make sure you're well hydrated, especially important for us Canadians during those dry winter months when the heat's cranked up. And give yourself time. Rushing can lead to injury, especially as tissues become less elastic with age. When should you see a doctor immediately? If you experience pain during ejaculation, blood in your semen, sudden changes in sexual function, difficulty urinating, or any chest pain during sexual activity. These are red flags that need professional evaluation, not Google searches, not YouTube videos, but actual medical attention. Now, I want to address something that doesn't get talked about enough, the relationship aspect. If you're in a relationship and your partner has health issues that prevent sexual activity, this can create real emotional stress. You might feel guilty about your own needs. You might worry that taking care of yourself sexually is somehow disloyal. Let me tell you something I tell my patients. Your health matters. Your sexual health is part of your overall health. Having an honest, compassionate conversation with your partner about this is crucial. Most loving partners understand and support their spouse's need to maintain their health, even if they can't participate directly. Some couples find that exploring other forms of intimacy, cuddling, massage, emotional connection helps bridge this gap. Others find that open communication about masturbation actually reduces tension in the relationship. There's no one right answer, but shame and secrecy are almost never helpful. I've also heard from men who find that after sexual activity with their partner, they still feel the urge to masturbate. One gentleman from Veracruz asked if this was wrong. Let me be clear. There's nothing wrong with you. Sexual response and desire are complex. Some men find that the release during partnered sex doesn't fully satisfy the physiological need for ejaculation, or they enjoy the different sensation. As long as it's not causing problems in your relationship or taking over your life, it's perfectly normal. From my perspective as Dr. Natalie Brooks, with over 20 years in urology, I want to be absolutely clear about when you need to seek medical attention beyond the emergency situations I mentioned. If you're experiencing progressive changes in sexual function over several months, if you're having trouble urinating or changes in urinary patterns, if you notice persistent fatigue or mood changes alongside sexual changes, these could indicate underlying health issues that need addressing. But for most men, age-related changes in sexual function are manageable. There are medications, devices, and techniques that can help maintain sexual health well into advanced age. You don't have to just accept decline. There are options, and a good healthcare provider will work with you to find what's right for your situation. So, is masturbation healthy for older men? The science is overwhelmingly clear. Not only is it healthy, it's beneficial. It supports prostate health, cardiovascular wellness, mental health, and immune function. It's a natural, safe, and effective way to maintain an important aspect of your overall health. And honestly, folks, the real tragedy isn't that men age and their bodies change. The real tragedy is that shame and misinformation rob them of something that could genuinely improve their quality of life. You don't need anyone's permission to prioritize your health. You don't need to feel embarrassed about maintaining your sexuality as you age. What you need is accurate information, and now you have it. Remember, sexual health is health. It's not vanity, it's not inappropriate, and it's not something you need to outgrow. It's a legitimate aspect of wellness that deserves the same attention as diet, exercise, and regular medical checkups. If you found this information valuable, make sure you're taking care of all aspects of your health. Talk to your doctor about your concerns. Stay active, whether that's walks around your neighborhood, hitting the gym, or just staying mobile at home. Eat well, and I know we Canadians love our poutine and Timbits, but balance is key. And don't let anyone convince you that aging means giving up on feeling good. Your health is your responsibility, and now you have the science to make informed decisions about it. If this video has helped you, give it a like so the algorithm can show it to more men who need this vital information. Subscribe to my channel and hit that notification bell so you don't miss more content about men's health, because I'm just getting started. I've got videos coming up about exercise for sexual health after 60, how to talk to your doctor about these concerns, and answering your most difficult questions about sexuality after 65. Share this with someone who could benefit, because together we can break these taboos and improve the lives of men across Canada and around the world. Whether you're watching from St. John's, Newfoundland, or from Argentina, from Medicine Hat, or from Spain, we're all in this together. Stay healthy, stay informed, and remember, age is just a number, but health is a choice you make every single day. Take care of yourselves, folks, and I'll see you in the next video.